All right, Joanna, we are live according to that button in the middle. How are you doing today?
I'm great. Thank you. How are you?
I'm doing well. Thank you so much for joining us today. And, I've learned so much, even in the 10 minutes that we spoke before the show started. But I'm going to ask you, of course, to repeat a bunch of the stuff you already told me. So we'll start out by having you just introduce yourself, because I didn't do justice to your bio because your bio there was so many things you're involved with. So give us like your version of who you are.
So I'm a cancer rights attorney and the CEO of Triage Cancer, a national nonprofit organization that provides free education on all of the legal and practical issues that come up as a result of a cancer diagnosis. And I have worked in the cancer community for almost 30 years and really have spent my legal career just teaching people how to navigate the systems, all the systems that come up that we don't really think of as related to legal issues, but things like accessing health insurance or even accessing healthcare. There are protections that exist that are actually rooted in the law. And so that is our goal, is to just teach people about their options and what the law says.
As I mentioned to you, Joanna, I have been involved in the law for 30 something years, right? Having co-founded a law practice myself. I'm not an attorney, my husband is, but I have never in that 30 plus years ever heard of a cancer rights attorney. So my question and my curiosity is, how did you get into that field? How many people are in that field or that specialty, and why did you choose cancer rights? It's interesting to
me. It's kind of an interesting and somewhat long story, but the short version is that there's really only about 10 of us that work specifically in the field of cancer rights law. And I never expected to come to this work. But when I was in college and actually in law school as well, I also worked part-time at a cancer center. And I was responsible for helping to coordinate the resource library and put materials in patient exam rooms and the logistics for support groups, and never really thinking that was what I was going to have anything to do with after law school. One of the things that I did in my role was actually work in one of the first centers that was in the cancer center that provided items for the comfort and cosmetic side effects of treatment. And so that included things like wigs and hats and scarves, but it also included mastectomy bras and prostheses for women after breast cancer diagnosis and surgery. And then I would have to bill insurance for those items on behalf of patients. And frequently insurance companies would come back and say, no, that's not covered. It's cosmetic. We're not paying for it. And I would have to call them up and say, this should be covered. It is a covered benefit. It should be paid for. And they would push back. And I would say, well, what about WICRA? So WICRA is the Women's Health and Cancer Rights Act. And it's a federal law that requires private insurance companies to cover those items. I only knew about that because I also happened to be in law school and happened to learn about that law. So if I didn't know that information, I wouldn't be able to propose it back to the insurance company. But the second I did, the insurance company would say, okay, we'll cover it.
Wow.
And so that really demonstrated to me, and it was really important.
I think we might have some technical. I think you froze for a little bit. We were talking about WICRA. That's where we left you, and you were telling me that once you mentioned WICRA, the insurance companies would then yes.
And so that just demonstrated to me that if you don't know what your rights are, that our systems, including our healthcare system, can walk all over you. And it just me demonstrating that I knew the acronym of a law was enough to get coverage for that item. But if I didn't know that, and I just went back to the patient and said, I'm sorry, your insurance company isn't going to cover this, in some cases, that was thousands of dollars for those items that patients couldn't afford to pay out of pocket for. So it really, and that's just an example of something that was after treatment. Imagine when insurance companies are denying treatment that can actually save your life.
Right.
And so for me, that really just taught me, interestingly, in a real life situation while I was in law school, how important knowing the law and what your rights are.
I'm so glad that you did. Again, like you said, it's only 10 of you, or maybe 12 in this entire country. So it's definitely something that's novel, even though you've been at it for 30 years. It hasn't caught on. And I think one of the reasons I was asking you, how do patients pay you? And your response was,
it's all free. Everything that we do as an organization is free. So we host free educational events, we have free resources and materials, and we have a free legal and financial navigation program where people can contact us and set up time to talk with our staff and really get an understanding of their individual situation and what their rights and options are.
and what I found interesting, because, I said it's a little bit different from the traditional lawyer representing your client, that you guys don't really have individual clients, but what you guys do is almost like you offer all this free consultation to clients, well, to patients, right? My law mind is like going crazy trying to fit you in a box when you're not really in a box. But I understand what you're saying, and so the patients have the advantage of, as you said, of being educated about their rights, which is huge, because like you demonstrated, if you didn't know about what WIPRA was, then you just get bamboozled. So how do you get your message out? How do you reach those patients? How do they reach you? How do people know about you, since it's such a small niche area of law?
Well, last year we reached about 1.3 million people across all of our programs and services, but we have the benefit of partnering with more than 150 national cancer organizations. And really, we get the benefit of doing that because what we do is so specific. And so we fill that gap in the cancer community, and it allows us to partner with so many other organizations who can tap into what we offer. And we share through those organizations, but we also train healthcare professionals on these topics so that they're better at understanding what patients and families are going through, and understand that there are resources available to point their patients and families to get help.
I want to come back to that about the training. We know that, unfortunately, this is a question from the audience, but unfortunately, many people don't even have insurance. Are there other rights that exist in the US beyond just people with insurance? Don't know if you understand that question.
Yeah, so I think what I'm understanding is there are definitely a lot of different types of health insurance options. And you have to meet the eligibility requirements for those types of options. Unfortunately, in the United States, there are some individuals who don't qualify for any options based on where they live. And so that is a downside to our healthcare system in the United States. But there are other types of rights beyond just insurance. So thinking about your employment rights, do you have the ability to take a sick day? Or can you use the Family and Medical Leave Act as a caregiver to take time off work? So really, we want people to understand that regardless of where they are in the continuum of care or the issue area that they might have, is that they might have rights, and to understand what their rights are before they start to make decisions. And that might be about how to work through treatment, how to take time off, how to go back to work, or maybe instead they can't go back to work, but they could file for disability insurance benefits, or just understanding how to navigate your medical bills and knowing whether or not you qualify for charity care programs at your hospital that may discount or write off the balance of your medical bills. There's all these nuances and tips and tricks to best navigate these systems that we try to teach people about so that they can get through these issues better.
My mind is still back there when you said that there are certain pockets or parts of the country where people don't qualify for any insurance. Why would that be the case? I'm just curious, really.
So it could be based on immigration status. So depending on which state you live and your immigration status, you may not be eligible to buy health insurance or qualify for a program that will provide access to healthcare.
Got you. Okay, all right. I can understand immigration status, but that should be perhaps the only thing, right?
It might be. So unfortunately, there are still some states in the country where health insurance options are limited. And it might be that you don't have a job that offers health insurance coverage and you make too much money at your job to actually qualify for Medicaid in your state, for example. But you also can't afford the marketplace option in your state. Because the cost is too high there. So sometimes people do fall through the cracks in certain states because the options that are available in those states are limited.
So wow. So poverty is, poverty is a real issue, right? I mean,
absolutely.
We talk about those social determinants of health. I know you probably hear that word every day, but when I talk to people like you and I'm hearing this stuff, just you have that bird's eye view of what's happening in the financial piece, and it's just it's no wonder the outcomes are so poor. And you and I were discussing this, Joanna, when someone gets diagnosed, right? The process right there is just about life or death, right? And the kids and all of the other stuff. And like I said, will I lose my job? And things like your rights don't even enter the conversation until you're denied maybe a wig or a bra or whatever you're denied. And so you mentioned training healthcare workers, and I was asking you before we got on the call, like, who is it? The doctors? And your answer to that was?
Most of the time, the healthcare professionals who are trying to reach out to teach are the ones that are spending the most time with patients. So nurses and social workers and navigators and patient advocates and even financial counselors who are working on the healthcare team, who are more likely to get questions about these topics or more likely to hear things like, my employer is making it difficult for me. I can't take off another day to come in for my next treatment or for a follow-up appointment. So even not necessarily there being a question, but just hearing that information can actually trigger for the healthcare professional, oh, they're having this challenge. I can refer them to an organization that can actually help them understand their options.
And you don't have to answer this question, but do you have a large team? Like, how do you field all of these, calls? And I know that you're free, but I know you get grants because I was on your page, and so you got a new grant. So congratulations for the work that you're doing, and your followers and fans were, of course, cheering you on because of what you're offering, in this space. But yeah.
So we do feel very strongly about providing free education and resources, and we are funded through grants and donations and sponsorships of our educational programs. But we are a very small organization. There's only 10 of us, and we do actually serve people in every single state. So we train healthcare professionals from every state. We help people on the navigation program from every single state. And before COVID, we'd actually delivered in-person educational events in every single state. And we feel very strongly about taking this information into communities everywhere, not just in maybe big cities where lots of national events are happening, but every community needs this information, maybe in a different way. But almost everyone who is diagnosed with cancer has to think through some decisions around work or insurance or finances. People might have different resources and the answers might be different based on where they live. but to think through what they need related to those topics is really what we want people to do.
So the question that was asked is, do you partner with advocacy organizations, which we already said yes, you did, to get the word out. I am still thinking, with your team of, let's say, 10, are you able to multiply that impact through the training so that some of these folks can answer some of the questions that would probably come to you and your team, but you're trained to know, if you're asked this particular question, here's where the resources are. Is that the kind of training that you deliver to your
exactly?
Okay, gotcha.
Yes. So,
okay.
to answer some of the easy questions about what are your health insurance options, or, what's the Family and Medical Leave Act, but even healthcare professionals or the staff of our partner advocacy organizations, they often will call us on behalf of the patients and families who they're serving to ask questions directly, because they want to know the answers so that the next patient that asks them that question, they have the right answer and can point someone in the right direction. But there are some really complicated issues that do come up related to legal issues, and we often are providing that type of technical assistance for the groups that we are partnering with or the healthcare professionals that we're training.
Do you guys ever have to go to court or anything like that?
We don't. So we feel really strongly that the reason we created Triage Cancer as an educational organization was that litigation and suing someone doesn't always get the results that someone wants or in a timely way. So if someone wants to improve their employment situation, filing a lawsuit against an employer, that can sometimes take years to resolve. And that doesn't create a great working environment in the meantime. So litigation doesn't always lend itself to solving some of these problems. And that's why being able to advocate for yourself, whether it's with your insurance company or your doctor or your employer or whatever else you need, we do a lot of education around self-advocacy skills. And we know that not everybody has those or has the capacity to advocate for themselves when they're not feeling well and dealing with their health issues. But that's why we teach whole families and caregivers and the healthcare team about this information as well, so that we can create a support system around a patient to try to get these issues addressed.
Awesome. What role do you think pharma companies can play in making life-saving treatments more accessible and affordable?
Well, I definitely think that pharmaceutical companies can help improve health literacy and partner with patient advocacy organizations to improve that health literacy and health insurance literacy, and look at how they choose to price drugs in a system that has a lot of money. So insurance companies and hospitals and healthcare systems and pharmaceutical companies and biotech companies and medical device companies, the healthcare system in the United States has a lot of money in it. And the challenge with lowering costs for patients means that everybody has to come to the table and make a little less money. And that is hard to do because everybody has to agree to make that happen. And certainly the government plays a role in forcing some of those players in the healthcare system to the table to try to negotiate lowering those prices and lowering the cost for patients.
Wow. It's you don't want to say, we work a lot with pharmaceutical companies, so I don't want to say too much, but I do your point about there's so much money in the system that you wonder, gee, couldn't something be done for the poor people? A sliding scale, maybe, I don't know. You would think that with all these bright minds, if their heart was there, it could happen. What is, honestly, you sure? What's the most egregious thing you've seen out there in terms of people's rights being violated, or especially after a diagnosis?
I think the hardest thing for me to see personally, and for us to see as an organization, is when insurance companies are denying coverage for medical care that is medically necessary, or having patients jump through a lot of hoops to get access to that care, like going through and having to get prior authorizations and delaying the time frame for a patient to actually get access to that care. And unfortunately, appealing denials of coverage is a pretty rampant problem in our healthcare system. And people don't know what their rights are. When an insurance company says, no, we're not going to cover something, people don't know that they can appeal that decision.
Right.
And what I find interesting about that is we live in a society that can be very vocal, and can talk about the challenges that they're having with companies. Like they may not have gotten a refund from a company, or they were shipped the wrong item. And I think people know how to advocate for themselves in that setting, but not in healthcare. And that's kind of interesting about our system. But we have laws and we have legal protections that allow us to not take no for an answer when an insurance company says no, but no one uses it. And when I say no one, it's 99.9% of claims that are denied don't get appealed, even to the first level of appeal. Only 0.1% of all denials are getting appealed. So where is the breakdown in people being able to tap into that protection? Because if people are having their coverage denied, that means two things are happening. One, patients aren't getting access to the care that their healthcare team prescribed, or two, they're paying for it out of pocket.
Right.
So either we're impacting access to care and an impact on someone's health, or we're impacting their financial health. And we're contributing to financial toxicity when we don't know our rights to the appeals process.
It is so aggravating. I have to tell you, it's so aggravating when I'm hearing you when I'm hearing you talk, because look at the lack of knowledge, right? It says 99% of people do not, my God, they don't argue that denial. They don't appeal at all. And the reason they don't appeal is one reason only: lack of knowledge. So I really, your job, again, you're so niched, and I guess there's only like 10 of you in the country. And I've never heard, I said, I've never heard, but prior to me connecting with you on LinkedIn, never heard of a cancer rights attorney. But boy, I tell you, I sure wish we had one like in every city, because cancer is such a pervasive. It's so widespread. It's so common, unfortunately. And these financial issues are even more common. And when I think about what you just said, Joanna, that either people are not getting the care that they need, or they're coming out of pocket, maybe selling everything they have because they want to live, right? Taking on second mortgages and all this wonderful stuff just because they want to live. And then when we talk about the fact that these pharmaceutical companies, as well as these other companies, have the money that they don't need to have people going broke or bankrupt to pay for this stuff. And yet here we are. And yet you're doing your great work, and it's still, we're moving the needle 1%. It's really heartbreaking. Someone asked, Joanna, thanks for being with us here. Is there a better way forward without PBMs? I don't know what PBMs are. Maybe you know what that is, Joanna. Or do you think necessary evil? I know this can really add extreme overall costs.
So pharmacy benefit managers are middlemen companies between pharmaceutical companies and patients, really. So they're in the middle of that work stream of how patients actually get access to drugs. And part of the challenge with PBMs is that there's not a lot of transparency about how they operate. and how they have a financial impact on the cost of drugs. And so there's a lot of discussion right now about, are they an unnecessary evil to the healthcare system and just adding another barrier, another additional cost to drugs? I will say that's not my primary area of expertise about that pipeline of what those costs are. But I do think that our overall healthcare system is overly complicated.
Yeah.
And when you have more players in that pipeline of how a drug gets made and then it gets to a patient, it can create complication. We have a lot of laws and a lot of regulations in our healthcare system that sometimes, we need because there was a problem and a law was passed to try to solve that problem or protect someone in the system. And then there are a lot of laws that really overly complicate our healthcare system and probably contribute to increased costs.
Well, we'll take a couple more questions and then we'll wrap it up. But what policy level changes do you think need to occur to simplify coverage for cancer care so that patients can better understand their rights? Yeah. What do you go to Capitol Hill? I mean, are you up there with all right? You're up there.
I have, yes, and we certainly engage in advocacy efforts because we wouldn't be able to do the work that we do if there weren't advocacy efforts, because those advocacy efforts contribute to policy and legislative changes that become laws. And then we have the information to teach people about. So we are very involved in advocacy and we pay very close attention to what is happening at the state and federal level and how it might have an impact on the cancer community. But unfortunately, there's what we would want to change in an ideal world, and then what will actually happen based on the way that policy and legislative changes happen in real world. So, I think certainly having a single payer healthcare system in the United States would be the easiest way to simplify coverage for healthcare. But that doesn't mean one thing. There are lots of different models for single payer healthcare, but anytime you have more payers in the market, it just creates complication. And depending on where you're getting your coverage from, the rules are going to be different. And so then you have to understand the rules specific to you and the type of coverage that you have, and sometimes in the state where you live. So it definitely complicates understanding.
We believe knowledge is power, and to have someone like Joanna on our program is the beginning of power in the financial toxicity realm in cancer. I agree. Whether patient or provider, it is always a consideration. Thank you for your work. And I'll just state this one, and really, Joanna, you're 30 years, you're out there. I'm so warmed, especially coming from the legal side, to see. I feel like you're almost like a social justice advocate or something, right?
It is. I mean, we believe that access to healthcare is a civil right, and it is a civil rights issue, and a social justice issue, that everybody should be able to access the care that they need in the United States.
Yeah. See, I resonate, in that world of equality. Everyone should ever, get what they need. So when I heard you talking about you were in college and that you were exposed to this and the injustice and so forth, I just felt like it was born then, because you had that heart to advocate for those who are less fortunate. And it's a wonderful thing, and never lose that. And the last thing I think from one of our team members is, why do you think patients are denied coverage? And I don't know if you know all of the answer it is, but especially when it is needed. I think for this person who's asking, they're young. And it just doesn't make sense. Even when you're old like me, it just doesn't make sense when I hear these things. Like, why are people being denied coverage? Why are people being, why are people being denied? And they could appeal and actually get through. And the insurance company knows that, but they deny them because they know that they don't know, that the people don't know their rights. And you say taking advantage of that. And, you said something, Joanna, you said it would require everyone coming to the table. And that's a hard, it's a hard pill to swallow for people. But I always think of it, right? Like when there's a problem, where is the leadership? And I don't know who would be the person to get them onto the table, but boy, you sure wish that there were some other people in positions that would have the heart that you have, right? Like we all talk about this problem, the toxicity, the social determinants, well, all of this wonderful stuff, but it's almost like who is taking it in charge and saying, let's get to the table and let's discuss. And I don't see it, but I'll let you answer this person's question, Madison's question, and then I'll let you go with a final word. But it's just upsetting to me when I hear these things sometimes.
To me as well, and that is really what drives us in our work, is that it is upsetting and it is unjust.
Yeah.
And in a world where we don't expect it to be fair, we do expect it to be just.
Yes.
Especially as lawyers.
Yes.
So I think, unfortunately, and I say this, and I don't want to sound sarcastic or flippant when I say it, but unfortunately, it is a business model to just deny coverage and know that people aren't going to question it and that people aren't going to file an appeal. And in a worst case scenario for the company, someone will appeal and they'll have to pay for the care that they were supposed to pay for to begin with. And that is literally the business model. And I do think, I hope that one day there is someone in a position of power who has the heart to realize that healthcare is more than just about making profits. But in the United States, as long as healthcare is a for-profit endeavor, people will look at how to make that profit. And in some ways, in a capitalistic society, you have to accept that, unless we decide as a society that we don't want healthcare to be a for-profit environment.
And that's another conversation, isn't it? Right?
It is.
It's another conversation for the social justice folks. But I so appreciate what you do. And Joanna, this particular episode, I want to re-air it is as a pre-recorded one, maybe within the next month or so, because I think it's so important for patients to know that, okay, even if its key takeaway is, if you're denied coverage, guess what? You have the rights to appeal it, and most likely, you may get through. Even just that one key takeaway, even just the fact that you can appeal it, doesn't feel like, okay, now I have to sell everything so I could live. That's just such a key information. So I really thank you for sharing that. And as we're leaving, what is your the last thing you want to say to that patient who might be flipping through? We have a lot of patients who watch this show, and we have a lot of advocacy groups who watch this show. What would be your final word, to final charge, final word, final note of encouragement? I mean, I'm encouraged that you're out there. I'm discouraged that it's such a small area and you're doing so much. And boy, I tell you, I pray you continue to be funded, because the work is so important. And I just wish you could be multiplied. That's all.
Well, we certainly are trying, and that's partly why we train healthcare professionals and other advocacy organization staff, is because we want them to spread the word as much as possible. I would say thank you for having me on and helping us spread the word about the availability of the resource that we have available, but also just the issues, so that people know if they are having trouble with employment or insurance or finances or estate planning issues or housing or education rights, there are laws and there are protections. And if you find yourself in a situation where you're facing a challenge, step back and learn about what your options are before you take next steps, so that you are as best prepared as possible.
Well, spoken like a lawyer right there.
Sorry.
The lawyer came up, which is good. But thank you, Joanna. Thank you so much for what you do, for who you are, for answering that. I feel like it's a call on your life, answering that call in college in law school to, you know what, because I know that you could have graduated and made a lot of money on the other sides, all the options that's available to lawyers, but you chose, or this role chose you stepped up to it and you're doing it. And I wish you more blessings, more funding, more grants, and definitely, an expansion of what you do. So thank you so much for coming on here today. And thank you guys on the feed for asking those questions. And if you're on the replay, please, Joanna is tagged. You can follow her to keep up with what she's doing on her page. So until next time, take care, you all who are watching. And Joanna, I'll just circle with you in a second.
Thank you
Take
so
care,
much.
everyone. You're very welcome.